Dear audience, welcome to the show PowercHat. In today's episode, we are discussing about development and humanitarian work during the time of crisis, with particular focus on the rights of children and alternative education. Joining me today is Mr. Janis Ginting. He is the National Director for World Vision International Nepal. Please allow me to welcome him. Welcome to the show, Mr. Ginting.
Thank you, Laxman D. Thank you for having me again.
Well, it's been tough for all development workers here in Nepal and elsewhere during the time of COVID-19 pandemic. The unprecedented challenges are faced by everyone. So I would like to start with a very general observation of yours. Janice, how do you analyze the current state of humanitarian and development work in Nepal is with reference to the COVID-19 impact into your ways of work?
Thank you, Laxman D. It is very challenging in two ways. One is the primary and secondary impact of COVID-19, including the long lockdown in the past few months and recently, have really causing a lot of challenges, especially for those the poorest of the poor. It is not just the pressure to the health systems, evidenced by overwhelming health system to treat the patients, but also to the other aspects like economy in particular, and some aspects of protection and of course educations. I'll give you an example. World Vision assessment report, then also consistent findings from other NGO and UN agencies indicates that over 50% of those vulnerable groups actually lost their income more than 2/3. And this actually very difficult, especially for people working in formal sectors like daily wage earners, small farmers, small traders, but also family of the migrants that have lost their job due to COVID-19. So that is really, in terms of needs, our significance, but also the way we work on the ground. As you can imagine, there's a lot of movement of restrictions to deliver, PPEs and other materials to support frontline and also the children to study. It really takes us a while to get to the field and making sure we protect our staff, our partners, and children and community safety. So it's as you said, very unprecedented environment for us.
Well, Mr. Ginting, as your organization, World Vision International, is working for children and the vulnerable communities here and across the world, wherever your offices are located, what are the key challenges in upholding the rights of children and vulnerable communities?
Thank you, Laxman D. I think you're right that there are certain groups of communities that are mostly affected as well, despite every part of population actually impacted. Children is one particular group that even though relatively they are less vulnerable to the COVID-19 risk, but the loss of income of the families that cause also some increased domestic abuse of violence at home. The prolonged cases of school closure actually makes children very, very vulnerable. They are not just economically and healthy-wise also very vulnerable, but also mentally because of all these pressures coming to them. The other groups, as you said, are those from communities, for example, people or community from minority groups, families of migrant workers and smallholder farmers or informal sectors, but also as particular children with disabilities or from ethnic groups that have to have some extra support to support education. These are all very vulnerable populations impacted by COVID. In terms of programs challenges, as what I've been mentioned earlier in terms of significant needs, there are also some operations challenges. For example, World Vision providing over 15,000 self-learning materials for grade 1 to 5 to over 14 districts. But over 2,000 of the school have been used for the quarantine, for example. Therefore, it's hard to find teachers. So we have to really work hard to make sure that the logistic of these materials are able to reach the children directly, and or the schools or the reading camps where children can take the books, and many issues that we probably can discuss further around access to internet, technology, even community radios. And I think in particular children from minority groups and with disabilities, because they require some certain support, either using local materials or certain ways to enable them to learn. It's even more challenging for them. But World Vision working hard to work with Ministry of Education, Science and Technology, and other partners to make sure that we can reach as much as possible. But to be very honest with you, only 1/3 of the children and the student populations, almost 9 million in Nepal, from pre-primary to tertiary education, actually only access the online learning so far, and that actually reflect the demography which very much urban areas.
Well, Mr. Ginting, these are really motivating initiatives that your office is doing for the well-being of children during the time of crisis, especially finding alternative way to provide them education or engage in educational activities. A study published with support from your office that you are just referring, assessment of the child well-being during COVID-19, that states that majority of the children, actually over 88%, are upset due to the school closure. And while, as you mentioned, less than 1/3 of children are participating in online or alternative education or classes. Don't you consider this widening gap as a major barrier to education? What are all other alternative ways out to this crisis?
It is indeed. I guess, as I said earlier, almost 9 million students actually affected by these situations. Only limited of them, especially and only in urban area, that able to access to these educations. I think Laxman D, it's again, first of all, it's not unique to Nepal, but also even many other countries in the world. But there are some ways that World Visions and other development partners can support. First, for example, majority of community and children are able to access community radios. So World Vision works with community radio associations to broadcast a program called Hamro Gar Hamro Patsala, basically helping children and parents to be creative, to be able to express themselves during this pandemic time in lockdown, and try to be able to find activities that help them as part of learning as well. So we've been able to reach almost 100,000 children through the community radio program with partnership with over 200 community radios. Also, World Vision works with UNESCO, Ministry of Education, Science and Technology, and an NGO to develop a curriculum-based radio program, what we call Samudayik Radio Patsala. So basically, an hour a day, we broadcast a program that relating to the curriculum, especially for grade 9 and 10, to help them having a continuous learning at home with support from the parents, but also have some ability to really to release the stress because of the school closure. Also, as I said also earlier, that yes, majority of population, perhaps over 60%, able to access community radio, but there are people and children, especially in remote areas, or those without having radio or mobile phone, that can listen to radio. So in this regard, World Vision works with Ministry of Education, Science and Technology, and some local NGO, also to distribute self-learning materials like books to over 7,000 children, especially from early grade 9, 1 to 5, to help them having books to read. And our monitoring programs and our monitoring and evaluations actually indicates that with all these supports, help us really children, A, to release the stress, B, have some fun, and also having some opportunity to continue learning, but recognizing, as I said earlier, children with disability and from minority groups, there are a lot of ways that we can support. I guess moving forward to sustain this initiative, I guess Laxmanji, I think it's important to take opportunity. I think for Ministry of Education and Education partners and INGO and local NGO like World Visions to continuing developing a more on low cost technology that are able to produce both accessible learning materials in either local language or in language that are easily digested by children, but also accessible to most of the children. And hopefully, we can also create a bit more tailored materials for children with disability and from minority groups.
Well, Janice, what are your suggestions to the stakeholders, including Ministry of Education and other stakeholders within education system? How can this gap of access to the online classes and alternative way of education be narrowed down, and it can be made sustainable in a way for children?
Thank you, Laxmanji. I think first of all, I understand with our partnership and coordination with Ministry of Education, Science, Technology, UNESCO, and other development partners working in education. I think first of all, the first priority at this moment, Laxmanji, is to really develop or finalize the school reopening framework, including the risk measures that will allow as soon or as much as possible the children to resume schools with all safety measures in places. I know this is not easy, but this is a short term or medium term strategy that we believe Nepal government is working on. But I think what probably can be done better is to communicate the strategy of school reopening to make sure that children and family and community feeling safe about that, but also participate in that. That will actually help a lot in addressing a lot of gaps that we were just talking about. In terms of the online learning, accessible learning, um, I think we need a multi-stakeholders approach. While Nepal government is taking lead with education cluster and other development partners and INGOs like World Visions and local NGOs, I think this is actually requiring a lot of multi-sectors, multi-partners approach. By that I mean Nepal has growing, for example, startup IT companies that can be supportive of creating such learning materials in a local language, accessible, not just going to radio program, but even can be pushed through either SMS or even feature phone without smartphone application, for example. That is one thing. Secondly, I think there are roles of community leaders and parents, and especially local governments. For example, when World Vision distributed over 15,000 learning materials, we advocated actually for Palika to top that up, and they actually can use their own resources to develop and to buy more local materials. And because they are on the ground, they're also able to deliver in partnership with local communities. And I think the role of parents are critically important, recognizing many of the parents also need to find works and to feed the family. But I think their roles to help children, either studying for a few hours at home and helping them finding creative way, not just going traditional way of education by reading books, but through traditional home chores, for example, that also require their roles. And I think finally, as I said, I understand what Visions in partnership with many education partners are also seeing this opportunity to perhaps revolutionize the way we're learning, especially developing some low-cost technology or technology that does not require a lot of cost and infrastructure to provide a more sustainable and at scale learning materials to all this population, reaching out from the Terai lowland region to hilly and also mountainous region.
Well, Janice, I'm asking you comparatively different question, but related to your way of work. Do you agree that the children and vulnerable communities in Nepal are left out of the development process here in Nepal?
Look, Laxmanji, this is unprecedented crisis, and I do not think any government, both from developing middle income countries or developed countries, are prepared and ready. We also understand Nepal government through education department have actually provided over 240 million Nepalese rupee to provide some learning materials. But as I said earlier, there are rooms for improvement. I think to address specifically to your questions, I think it's important for the government of Nepal and all donors and development partners like World Visions and other INGO and local NGO, even the media like you and other private sectors to first understand the needs of these children in the most vulnerable communities. By that, we mean that we can't always have a one fit for all suggestions. It's important to understand their needs, especially those very vulnerable, like children with disability, those from minority groups, to understand what are the needs. The other thing, I guess, Laxman, that I think can be a learning, I guess, from other partners. World Vision has implemented what we call accountability mechanism, where we have different channels for children and communities to voice out their critics, their feedback, and their appreciation toward vision programs through mobile phone, a text, but even some SMS, so that World Vision knows what's going on with the program implementations. And we got so many good feedback, even thousands of feedback every month, to appreciate the work mostly, but also to for us to understand whether the needs are something that really addressing what they're really looking for, or the way we targeting populations as the target beneficiaries, but also the way we are working. I think there's a lot of ways that we can be more accountable, and I think this is just one way to improve accountability. I think to sum up your point around um, the works that require to serve more these people from vulnerable communities. I think I certainly with you agree with you that there are really gaps. But within this crisis time, I understand it is not very easy for any government. I guess what is important, perhaps, Laxmanji, and we can elaborate further, is really to make sure that the government of Nepal able to articulate the programs and policy options to the communities, to the people of Nepal, so people understand what to expect, and at the same time, what roles they can play to address this very difficult time together.
Well, Janice, also there is criticism that in the current state of pandemic, authorities in Nepal are not so sensitive towards the specific needs of children and vulnerable communities. What is your observation on that?
I think my observation is that we have so many competing priorities now, and I think it is understandable if the primary focus, as it seems now, Laxmanji, is very much on the addressing the primary aspects of COVID-19, which is the strengthening health systems and supporting those are affected of populations. As I said earlier, I think from this perspective, where some of population group like children may not be significantly affected, and others that can be perceived that way. But I think we should give a chance for Nepal government to be able to address these immense needs. And I guess we need Nepal government definitely to take leadership. But as you can see in many parts of the world, that it is not only the government roles to address this crisis. And I think each of us are having ways to contribute to that. As my really a strong recommendation, I guess, Laxmanji, is to help the people of Nepal understand, especially those perceptions around lack of awareness or lack of support, is really for the Nepal government to really communicate well and systematically and regularly and predictably of what programs and policy options available to help those from vulnerable communities. I think to give an example, as this is not only the health crisis but also economic crisis, I guess we hear a lot of initiative around Prime Minister Employment Program. We also hear about leveraging social protection mechanism that already exists but need to be done more. I think this is all good initiative, but I think what World Vision like to advocate to government Nepal and other development partners, including local government, is to really clarify what the programs looks like when these existing programs are leveraged. Will the Nepal government put more investment or money in these programs? Will there be any efforts to improve better targeting of this programming and monitoring also the program? And how do we know that people that are targeted specifically, for example, single and female headed households, children and headed households, widows and people with elderly population, for example, are able to access these social protection schemes, or the youth able to access these economic programs? I guess it hasn't been always communicated well, and we don't know the scale of the implementation of this program, Laxman G. And I think World Visions are keen with other development partners to help Nepal governments, A, to communicate what is the program about, and B, to help community understand how to access this program, and work with also local government to make sure that we can monitor and execute the program very well, so that we can also measure the impact. I think by that, I guess, Laxmanji, you can really show evidence of extra effort put in place to address this unprecedented crisis. But if it's only on the policy narrative or the program's narrative without unpacking the details by timing, by targeting, by resources budgeting, I think it still will be perceived as lack of support to those specifically and mostly impacted by this crisis.
Well, that's really interesting insights, Janice. Let's hope that the government of Nepal would keep these things in mind. What long-term strategy would you suggest to address the COVID-19 recovery in Nepal? Very briefly.
Thank you, Laxmanji. I think it will be a more coherent economy and health programs. As I said to you, the primary impact of COVID to health system will likely to continue. We probably haven't get the peak of this pandemic, but equally important is the secondary impact, which is the loss of job and income to so many populations, even on the formal sectors like you and me. I think having a great combinations of health initiative but also economic program will help. That's one thing. Secondly, let's talk about educations and also protection issue. I think we need also an adaptive strategy, recognizing COVID-19 may have the second wave and the third wave. So how can we have adaptive education strategy to support these children that are able to continue learning? And finally, I guess, Laxmanji, we need a multi-pronged approach, multiple stakeholders to come together, all sectors affected, from small business, from farmers, from widows, from people from the lead group, even children. So it's all affected. I think it's important to have a coherent policy and program frameworks that the Nepal government need to do in the long run. And because this is a marathon, this is a crisis that we expect the next few months ahead.
Well, Mr. Janice Ginting, there are many interesting insights you are sharing with, but we are coming to the end of the show. I would like to thank you for joining us. It was a pleasure talking to you. Thank you very much for joining us, Janice. Dear audience, time now to wrap up the show. Keep watching us. See you next week. Namaste.